And we welcome you back. CBS 2 is committed to breaking the stigma surrounding mental health. This morning, we're talking about the struggles college students face. According to the Substance Abuse and Mental Health Services Administration, 12.6 million people ages 18 to 25 have experienced a mental, behavioral, or emotional health issue in just this past year alone. Since more than 18 million people in this age bracket attend college every year, these institutions are at the forefront of bringing mental health resources directly to students. A nonprofit called the JED Foundation working with campuses nationwide to make that easier. Dr. Michelle Mullen joins me now. She's the Senior Vice President and Chief Design and Impact Officer at the JED Foundation. Good morning to you, Doctor. Good to see you.
Good morning. Thanks for having me.
Hey, great. First, could you just tell our audience a little bit more about what the foundation does?
Sure. JED Foundation is a national nonprofit that seeks to protect the emotional health and prevent suicide among our nation's teens and young adults. And we have a flagship program called the JED Campus that partners with campuses and universities across the nation. It's a 4-year program, and we help to guide schools through a collaborative process of looking at programs, policies, systems, and culture that enhance mental health and prevent suicide.
Now, JED just released a report on mental health on college campuses. What were some of the findings there, and what was most startling for you personally?
So this report highlights about 10 years of data and represents over 100,000 student voices. And we saw real significant improvement across the board. So we saw decreases in depression and anxiety, increased awareness of mental health resources on campus to promote help seeking and help giving. We saw improvements to graduation and retention, which speaks to the importance of having students feel good on campus and be connected. And we saw real improvements on suicide ideations, a reduction of 13% in planning, and an astounding reduction of 25% in suicide attempts.
Can I ask, what's the response been like with colleges across the country? You make that initial call over the last couple of years. You're trying to get this program in as many institutions as possible to be able to provide help to the student body. But what's the response been nationwide?
So I started researching college student mental health about 2 decades ago. And back then, colleges and universities would say, we don't have mental health issues on campus. And you would never hear a college or a university say that now. They are acutely aware of how students are changing on campus, and this increases the discussion and collaboration and problem solving that universities and colleges want to have with their students on campus. And so what we are seeing is that this comprehensive approach is really working and is effective. So taking it not just in counseling services, but across the campus as a campus-wide initiative to be able to enhance mental health and prevent suicide. And we have evidence now to show that it works.
You know, it's crazy to hear you say that, you know, in talking with school, well, we don't have a mental health issue here. Or, you know, and now things over the last, 5-10 years have changed so significantly. And now that it's so much more commonplace with, you know, you can talk to families and be like, oh, no, you know, Uncle Jimmy's fine. And then you find out that there is an issue that's been there for a while. You've got programs, though, that you take to these schools. Can you just describe what the program is like? Let's say I'm a student at, let's say, Syracuse University, and you're there. What can I expect if I enlist the help of the JED Foundation?
Sure. So the JED Foundation actually works with the leadership at the university or college. And so we are at SUNY Westchester Community College in Valhalla, Binghamton, Columbia, and Cornell. So we have some good roots here in New York. And the idea is that the JED Foundation provides expert advice and guidance through a technical assistance program that helps to identify what are the programs that you have, what are the policies that you have, how can we strengthen, what are the things that you're doing really well, and then we provide real and targeted expert advice that's data-driven on best practices to improve help seeking, connectedness on campus, responses to crises on campus. This idea is that it's not just the counseling services problem. It's everyone's job on the community, on the campus, to be able to promote mental health and help seeking and help giving. And
Doc, I've got 10 seconds for you here. If you had to provide one bit of advice for people seeking your help, what would it be? Come to our website, jedfoundation.org. We have great resources. The impact report is right on the landing page, so come check out our resources. And thank you for having me today. We appreciate your interest. Doc, we appreciate it very much, and we thank you for the service that you're providing with the JED Foundation. We appreciate that. If you or a loved one needs help, call or text the Suicide and Crisis Lifeline at 988, and we'll be right back.